Okay, we're going to talk about surgery for brain tumors today. And I think it's important to mention that surgery for brain tumors today is a lot more safe and a lot more efficient and a lot more effective than it was, say, 30 years ago or before that. And there are a number of reasons for that. One of the big reasons is we have better imaging to tell us exactly where the tumor is so that the surgeon doesn't have to kind of hunt around. We can go right to the tumor in the most direct way possible. We can, in so doing, disrupt the least amount of bone and brain itself, for that matter. We can do the least amount of retraction or moving around or pressing on the brain. So all these things contribute to the safety of the operation. The second major advance in the last 30 years or so has been in anesthesia, where we can now put the patient to sleep and awake the patient up much more readily, avoiding increased pressure within the head, which in the old days was a major problem with all of brain surgery. And what I'm going to say today really has to do with brain surgery for tumors, but it also applies to brain surgery for vascular problems, for trauma, for infections, and so on and so on. So anesthesia, the real advances in anesthesia, particularly the control of intracranial pressure, have been very key in enhancing the safety of surgery. The third area is the ability to monitor brain function electrically throughout the operation, whether that be of the facial nerve or of the brain stem or of the hearing, the speech areas of the brain. We now can monitor this throughout the operation, even though the patient is anesthetized. Now we can also do the operation awake, and that offers certain advantages, but there are disadvantages too, not the least of which is patient comfort and the ability to have more control over the situation. If a patient's asleep, we can have really greater control than if the patient is awake, because certain things like coughing and even certain movements cannot be avoided in an awake patient, and these can have deleterious effects on the operation itself. So that while we do awake surgery in certain circumstances, we tend to avoid it if possible. Now, in terms of other types of monitoring and other types of technology which are available during surgery, again, which enhance the safety and the quality of the operation, we have a device called image guidance. And this is a way to take information from the MR scan or the CT scan and import it into the operating room, and then position the patient and position the equipment in such a way that we can use a pointer or a probe or a wand, if you were, and point at the exact area, and then correlate that with the information we have on the scan, so that the scan and the patient are one. And the surgeon has the luxury of being able to pinpoint the pathology, direct the trajectory exactly to the pathology, and identify any changes which may occur. And this enables us to remove tumors more completely. It enables us to remove tumors with less damage to the surrounding tissue, and therefore it enables patients to wake up from surgery with fewer deficits in terms of their neurological function. I already mentioned the electrical mapping of the brain and the ability to control exactly what's happening to the brain electrically during the operation. I mentioned the anesthesiologic considerations, which have been very important. And finally, we have new technology in terms of the actual manipulation of the brain. We have lasers, we have ultrasound, we have very fine ways to coagulate vessels without spreading the heat to the surrounding tissue. And all of these, in turn, enhance the safety of the operation and the quality of the operation and the outcome of surgery, so that the net result is that the patients today who are operated for brain problems, whether they be tumors or other diseases, wind up coming out of surgery pretty much the same way as they went in most times. Now, that's not to say that we've solved all the problems or that there aren't bad things that can happen during surgery, because there are. but by minimizing the exposure, by shortening the length of the operation, by using the adjunctive physiologic and radiographic tools, we can get a better result. And people now are being discharged from the hospital a day after surgery, or 2 or 3 or 4 days after surgery, whereas 20, 30 years ago, they were in the hospital for weeks and then to rehabilitation and so on and so on. But so it's, I think we've seen a real revolution thanks to technology. Can I say that the surgeons are really better in terms of their hands and their fingers and their eyes? Maybe they're somewhat better, but I think that the real advances have been made by the people who invent all these wonderful technological gadgets that we can use today to help our patients.